This is Akashvani. In the program Spotlight, now we bring you a discussion on transformation in India's healthcare sector. The participants are Dr. Raman Gangakhedkar, former head scientist, Indian Council of Medical Research, and Omvesh Upadhyay, Akashvani correspondent.
Healthcare has become one of India's largest sectors, both in terms of revenue and employment. The Indian healthcare sector is growing at a brisk pace, and due to its strengthening coverage, services and increasing expenditure by public as well as private players. And today we will discuss on the India story and the significant progress in the healthcare sector and how India is becoming the medical hub and pharmacy of the world. To talk on this, we have with us renowned scientist Dr. Raman R. Gangakhedkar. Welcome to the program, Dr. Gangakhedkar.
Thank you.
Dr. Gangakhedkar, to begin the discussion, I would like to mention that yesterday Union Minister of Health and Family Welfare, Dr. Mansukh Mandviya, delivered the keynote address at a Quad Plus side event on tuberculosis during the 76th World Health Assembly. He shared that India is the only country in the world to have developed its own mechanism for estimating its TB burden. So what we know right now is that India has set the goal of TB Mukt Bharat 5 years before the global deadline. So whenever we talk about India's effort towards making India TB free and how we are continuously in this process of upgrading and improving ourselves, how do you see that, especially in the healthcare sector?
In 2018, our Prime Minister, he declared that India would perhaps go ahead faster towards handling tuberculosis because TB was causing far more deaths compared to all other infectious diseases in a year. And he set a goal that India will eliminate tuberculosis in 2025, whereas the entire world was given a call by World Health Organization that TB would be eliminated in 2030. And once Prime Minister provided that kind of leadership, the budget to ensure that implementation improves, the diverse strategies that one has to adopt would be started in the country, that the entire thing received an impetus towards better implementation, and it was very much visible in different sectors. Now let's look at few. We improved our diagnostics by using molecular tests, especially TrueNat, which is a test which is indigenously developed, and therefore the cost is also low, and it has a portable machine which can be carried into remote far-flung areas in a suitcase, and still you will be able to provide that molecular test to every patient whom you want to diagnose with tuberculosis. The major advantage with that is you can diagnose even drug-resistant tuberculosis and provide whatever treatment that the patient requires looking at the profile of drug resistance per se. Now that was one thing. But the second thing which was also recognized was that we will need public-private partnership because a large majority of the patients used to go in private sector. They used to receive all kinds of treatment and it was extremely difficult to control. So the country developed a software called as Nishchay. Any new case that is diagnosed, whether in public sector or in private sector, they will have to enter the case-related records in Nishchay software, and there was a continuous monitoring as to which drugs are being picked up, what happens to the patient, is the patient adherent, and he is taking the treatment, he has completed the treatment. All that was possible for tuberculosis only because of these initiatives.
Absolutely,
that we had.
Indeed. And when we are discussing the development of healthcare sector in India, in the same context, I want to do a small comparison where whenever you see that in West, for a very basic hospitalization, it can make you in debt. And in comparison to that, in India, we are providing 5 lakh of insurance under the Ayushman Bharat program, on top of the already working free services of government hospitals that caters to 1 million people otherwise on a daily basis. So with Ayushman Bharat program and then the facility that not only you can get treated in a government hospital but also in a private one, how it strengthen and empower the citizens that they know that healthcare is our right and the government is working in the very right direction for us. How do you see that?
Yeah, one needs to recognize that in country as large as ours, and the very fact that we have just moved towards, we are making major strides towards becoming a developed kind of an economy. one thing which we must remember is our healthcare infrastructure was inadequate to provide services that every individual would require all across the country. And therefore, one of the things which used to emerge, people used to access healthcare from private sector more. There were other reasons as well that were associated with access being taken through private sector. But one fact used to emerge that people used to end up going for catastrophic expenses. And what is a catastrophic expense? The catastrophic expense is, even if I was belonging to middle class, if somebody in my family, requires a quality care from, let's say, a private hospital, or I prefer to go to a private hospital, then in those cases, I might even be pushed by one illness below poverty line per se. Now, if we wanted to avoid that, there are two options that we had. We could have told them to go for health insurance, but all of us know when the entire thing in health is ruled by health insurance, it has certain positive things and it also poses some challenges in terms of expenses that the government is likely to make, which is evident in all developed countries, where even they find it difficult to actually provide budgets for care as such, even through insurance sector. So what we have done is we have prioritized the population that requires attention most, where these diseases used to occur. They are not rich people and therefore they used to hesitate to go to the hospital to take care, fearing that they will be pushed further below poverty line. And these people have been covered in Ayushman Bharat by 5 lakh rupees for expenses up to 5 lakh rupees, which is one of the biggest steps because this is the most vulnerable population. And if I cover that vulnerable population, my health-related indices, which I look at, would improve dramatically. Because
Absolutely.
they can receive care per se.
Yes, and whenever we talk about that, one of the key aspects and factors that helped in providing and giving healthcare to all and reaching the unreached is the digital healthcare infrastructure that we are developing, per se the Aabha number, unique health ID, e-Sanjeevani portals, who are gradually building the foundation of National Digital Health Mission. So, how do you see that?
National Digital Health Mission is critical for India. And fortunately for us, this is going to become one of our strengths, mainly because India is a superpower in software industry per se. And what has exactly happened is we have used every bit of our ability to develop digital health infrastructure. Now, one thing which used to happen was somebody gets a treatment somewhere, he will have to carry physical records all the time with him. And that may not be possible every time. More often than not, you ask any patient used to say, I cannot locate those physical papers per se. Now, what was the best way out? The best way out was you develop health IDs so that entire information is stored in that software so that anybody who wants to access that data would be able to see, and the past records will help a doctor to decide on the treatment per se. Second thing which is also important, which perhaps we have witnessed, is during the time of COVID itself. One thing which happened during COVID was because of the scare that the patient would have, that if he goes out and tries to access care for non-communicable diseases such as diabetes or hypertension or malignancies, now they used to stay back at home. And the fear that we had at that time was, how will we provide care to them? They also require care. Their fear is they will acquire COVID when they go to the hospital. Now, we used telemedicine very strongly during that period. And the entire program has now adopted significance under e-Sanjeevani program. E-Sanjeevani was started during that COVID period. We've also seen that the digital healthcare infrastructure was being utilized the best way during COVID vaccine rollout. All of us remember, just because of these softwares, the moment we used to receive COVID vaccine, you would find that the certification used to come to you through the internet at that juncture, wherever you might have taken the vaccine. So essentially, it has contributed immensely. This will also help us and ensure that even if people may not have a good health literacy, they may not be holding records correctly with them of the prior illnesses, all those records would be available through the health ID that is being generated as of now, and their treatment will become better. So that would impact their survival and quality of life as well.
Absolutely. One thing that should be seen as an opportunity for India is medical tourism. last year speaking at the Global Investment in Ayush Summit, Prime Minister Modi also talked about his commitment and vision of making India the medical tourism hub. If we share the stat that almost 2 million patients visit India, generating the revenue of around $5 million a year, and there are plans to triple it down to $12 billion within 4 years. So Dr. Ganga Khedkar, how could a push to medical tourism can bring dollars, jobs and laurel to India's soft power?
I would put it very simply. We have the best healthcare professionals that we can imagine in terms of training and the experience that we can have. If the sheer population size, the number of patients that a doctor would get, it tends to ensure that he learns more through the practice and the experience that he has. And therefore, with the quality training, you will find that our doctors become equivalent. When we talk of, let's say, Tata Memorial Hospital for cancer, it's considered as equivalent of any cancer hospital in the world. Now, which essentially means that we have everything here, and naturally you will find people from different countries, wherever the healthcare facilities are not of adequate quality, they would like to access the care here, not only for one reason that we have the best quality doctors and nurses, but also for a reason that the healthcare cost, even in a private sector, continues to remain pretty low. The result, you find that medical tourism has been increasing rapidly. When we say that we are earning $5 billion and look forward to earning more, what is most important for us to remember that India as a country has a huge soft power that comes with provision of healthcare services. It's not the money that we earn. The goodwill that we earn for those who have been suffering in the vicinity or in different parts of the world is immense, which perhaps is far more than the dollars that we count, because we have made a big name in medical tourism, and which is evident in the services that we are also providing to developed countries as well as those which are less developed. So medical tourism is bound to grow.
Absolutely. And as we enter the very concluding stage of the program, I want to know from you in very short that among the biggest challenges that we have in order to serve healthcare for all is the population that we have. But with aims in the Tier 1 cities and with recent developments of health infrastructure in Tier 2 and Tier 3 cities, and now extending that to even block and Gram Panchayat level, how do you see PM's vision of reach the unreached in near future?
I think the Prime Minister has done his best. Now, the issue is, if you actually look at, India has become one country where with COVID, even molecular tests are possible, even at sub-district level, which was hitherto perhaps a utopian goal for anybody to think about earlier. Now that we have molecular tests, now we will be able to diagnose different diseases using these molecular tests because we have the facility available there. When it comes to penetration for services, even the government has ensured that those in the remote areas, they will be covered by services which can be accessed even in hospitals nearby, for which there are certain contracts that they make. We have made major strides in terms of provision of healthcare, even at the remotest places, especially using telemedicine to try and ensure those who can be treated even at their village level would perhaps be treated there, and they would perhaps not face the unnecessary travel and the agony of going to different hospitals as the population of our country. Now, we need to access that particular provision of service as such. Now, if we do that really well, we have made the provision, and if people access those provisions, you will find that the impact on health will occur at a rapid pace, and therefore the community mobilization is something which is becoming far more important. We have now health and well-being wellness clinics established there in the lowest level, and you will also find that perhaps they will utilize those opportunities to mobilize community. And community should also come forward through Panchayati Raj institutions and ensure that everybody becomes aware of the services that the government is providing for people to live full life.
Absolutely. And with your insightful inputs, thank you so much, Dr. Ganga Khedkar, for joining us on Akashvani.
Thank you.
You were listening to a discussion on transformation in India's healthcare sector. The participants were Dr. Raman Ganga Khedkar, former head scientist, Indian Council of Medical Research, and Omvesh Upadhyay, Akashvani correspondent. This program was produced and presented by the News Services Division of Akashvani. You can listen to it on our mobile app News on AIR. This program is also available on our YouTube channel, News on AIR Official. You may share your feedback about this program through email at airnsdtalks@gmail.com or WhatsApp on 9289094044.